let's move on to the international situation. Let's talk about the country that is struggling to cope up with COVID-19 situation right now. It's America. America is reporting the biggest and longest wave yet. It has reported all-time high cases now. For last couple of days, if you look at the entire week, it's been reporting more than 1 lakh cases every day. The CDC has said that the cases and deaths are highest in small cities and rural communities right now. It's also saying there is an increase in cases in 94% of US jurisdictions. So it's spreading fast and it is a really worrying situation right now. If you look at the wave of daily cases, you will see that there are 3 waves that America has seen. And the current wave is the biggest and longest wave with maximum number of cases being reported. To talk about this, we are joined by Ashish Jha. He is the Dean of the Brown University School of Public Health. Thank you very much, Dr. Jha, for speaking with NDTV. Now, why are we seeing this surge in the 3rd wave, and which are the states that are suffering the most?
Yeah, so the situation in America is very, very bad. And the reason is that the Trump administration has largely given up on trying to control the virus. And they have taken a strategy of just letting the infection run and have as many people infected as necessary. And of course, that has been very harmful. And so we're seeing large outbreaks really everywhere in the country. Almost every single state is going up by a lot. But the states in the Midwest of the nation, North Dakota, South Dakota, Iowa, Utah, Montana, these are the places that are the hardest hit. But we're really seeing outbreaks every part of the country.
Right, and we are expecting that the new team will start working, but the tussle that we are seeing in the White House between the transition team of Joe Biden and Trump's team, do you think there will be a problem as far as the new team, the transition team, would want to execute its policies or might want to work? Will there be impediments to it?
So I think there's a lot of things the transition team can do to start making a difference. Of course, it would be very helpful if the Trump administration was cooperative. In 2008, when President Bush was leaving and President Obama was coming in, it was middle of a financial crisis. And the 2 teams worked very closely together to coordinate the transition. I've been calling for the same kind of coordination in the middle of this health crisis. But obviously, we're not seeing that out of the Trump White House. So I think that will make the Biden teams work harder. But there's still a lot they can do during these 2 months before they take office.
Right, but for them to do that, they need coordination between the 2 teams. Do you think this tussle that we are seeing right now could cost America, like in terms of lives or setback in fight against COVID?
Absolutely. So this lack of coordination and this lack of interest, I think, on the part of the Trump team to be helpful will mean that the outbreaks will be much, much worse in America, that it will mean many more people will get infected and more people will die. It is actually shocking to watch the Trump team not even try to prevent the deaths in Americans, and not even try to protect American people out of really a political calculation.
All right, Dr. Jha, let's not talk about the India situation. You can see that the overall numbers are going down, though there are still questions about the testing strategy of India, where we're using more antigen testing rather than RT-PCR test. And also, how do you see Delhi? The situation in Delhi, how do you see it?
Yeah, so what I would say overall about India is that things are certainly better than they were a couple of months ago when it was getting to close to 1 lakh cases a day. Obviously, it's better than that. Part of the reason it's better than that may be the switch towards more antigen tests. So antigen tests are quite good, and I believe that they have a lot of value, but they're obviously less sensitive than RT-PCR. So they are going to miss many cases that RT-PCR would have missed. So I think that explains part of what's happening. In terms of Delhi, I guess I have 2 thoughts. I mean, first, there was a lot of talk a couple of months ago that Delhi has hit herd immunity, that there's so many people that have now been infected that there's no chance of outbreaks in Delhi. I was very skeptical of that. What we are seeing in Delhi is really kind of a microcosm of, I think, what is happening in many parts of the world, which is the pandemic isn't going away. You're going to see ups and downs, and you have to be very vigilant. And anytime you start seeing case numbers rise, you have to get aggressive in controlling the virus.
Does that mean that it's all cyclical? It will keep coming back, this virus will keep coming back and hitting us till people are vaccinated?
It means that there is a cyclical element to it. We're seeing this in Europe, right, where Europe got hit very hard, things got better over the summer, and then it came back again. The way to think about this is that the virus isn't going away, not until we have large-scale vaccinations. And so every time you suppress the virus, if you take your foot off the brake, if you start to relax, the virus will come back. And the model that we've seen in East Asia, which actually has been much better in Singapore, Taiwan, but also in New Zealand and Australia, is every time they see an increase in cases, they get very aggressive in shutting down the spread. And sometimes it's through lockdown, sometimes it's through testing and tracing. But that has been the strategy that has worked. But what I expect is that we will see places go up, and then people will respond, it'll come down, and then it'll go back up again. And that's been the pattern around the world.
Right. And how optimistic are you as far as the vaccines are concerned? Pfizer has reported 90% efficacy. Russian vaccine has reported 92%. So how optimistic are you?
Yeah, so the Russia one, I would say I haven't really seen the data that makes me convinced that there is a Russian vaccine that's 92% effective. But the Pfizer data is more compelling. And it makes me, there are two or three responses I have to it. First, it's better than I was expecting. You know, if we were speaking a few weeks ago, I would have said, my hope is a vaccine might be 60 or even 70% effective. I was not expecting 90, and I am thrilled that I was wrong, that it's much better than I think almost any of us were expecting. Second, it actually raises my hopes about the effectiveness of other vaccines as well, whether it's AstraZeneca or Johnson & Johnson, Moderna. There are all of these other vaccines that are in production, and I suspect all of them will end up being better than what I was expecting, better than 60, 70. I hope they all come into the 90s. The big challenge, of course, in front of us is producing enough doses and getting it out to the world. And there is a whole global effort on this. Obviously, India has extraordinarily good manufacturing capacity for vaccines. So all of that will have to wait until 2021 until we get wide-scale vaccinations. But I am very hopeful now that we will see high-quality vaccines emerging in 2021.
Well, that's nice to hear that. Thank you very much for speaking with us. That was Dr. Ashish Jha, the leading public health expert from America. Thank you very much, Dr. Jha.